case count to 18,869. Of those, 2,890 are considered active infections, and 15,777 are considered recovered. We have 161 individuals who are currently hospitalized, and a total now of 202 deaths. We've had a total number of tests that have been reported to the South Dakota Department of Health of 245,387. That is among 177,023 unique persons. Just have one quick update as far as our clusters. So we reported out on Thursday that we had a cluster of COVID-19 cases at the South Dakota Women's Prison, and we are updating that number to reflect 116 total cases as of this morning. Did also want to provide an update on the K-12 schools and colleges, universities, and technical colleges. As of today, we have a total of 936 total 963 total cases in K-12 schools, and of those, 678 are considered recovered. We have 674 students and 289 staff that are part of those total COVID-19 case counts. For last week, September 13th through the 19th, we added a total of 261 new COVID-19 cases to that total. When we're looking at our South Dakota colleges, universities, and technical colleges, we currently have a total case count of 1,172, and of those, 1,043 individuals are considered recovered. The breakdown of those total cases and additional cases to that total case count for colleges, universities, and technical colleges.
All right, I'll go ahead and unmute our lines, and we'll take your questions. We're ready for your questions.
Hi, this is Joe Snevy with the Argus Leader.
Go ahead, Joe.
With the women's prison up there, do you feel like that's at some point they're all going to have that, and there'll be some herd immunity up there with those numbers?
So what I would say is that, we continue to work with the Department of Corrections to look at transmission risk itself.
Next question.
For you to them to discuss the different ways that they're mitigating COVID based on the layout and the physical environments of the different facilities.
Next question.
How about the breakdown of staff versus employees at the women's prison?
You'll see that on the DOC website as well.
Next question.
Yes, Todd Epp, Kello.com News.
Go ahead, Todd.
Wanted to follow up on Joe Snavy's question. What role, if any, do you think herd immunity plays in this, and is that any sort of official policy by the State Department of Health?
Well, there's no official policy from the State Department of Health around herd immunity or trying to achieve herd immunity in a specific population, if that's what you're asking about, Todd.
And what I would say specifically, when we're looking at a defined small population, it's a little bit easier to talk about what level of transmission and the number of cases and how that might overall impact future cases in terms of the risk of transmission. When you're talking at a community level, though, as I've mentioned before on these calls, we have under 20,000 total cases, and that's a drop in the bucket compared to the size of our state and the population of 884,000. So, herd immunity is not something that we talk about on a community level, with the exception of getting toward herd immunity when we're using vaccination, which we'll start to be talking about more, into this fall.
Can you give an example that maybe people would remember where herd immunity did take effect in some sort of pandemic?
There are no specific examples that I'm aware of.
So is this a theory or is this scientific fact?
Well, this is based on, the evidence that we know of COVID-19, both transmission risk, as well as when it comes to the level of ongoing spread in an individual who has already developed COVID-19, which we know there is a window period of about 90 days after somebody develops COVID-19 when the likelihood of reinfection is extremely low. And so all of this, plays into that a designation of kind of that herd immunity at a community level. The other thing that we don't yet fully know is just when we're talking about antibody tests and the level of protection that individuals might have based on identification of antibody and what that looks like when we're talking about seroprevalence surveys that have been done. And I would refer
The population that people, as long as they keep up with those vaccines, are going to be
general background information would relay to COVID-19 as well as other diseases that we have seen that were common childhood diseases and that we still do see to a certain extent, such as pertussis. And that two main ways that we're looking at that are through natural infection with the virus or the bacteria, or through the indirect, you can get exposure to the vaccine that produces that produces that level of immunity. Or the other way is looking at, this is one of the treatments, is that convalescent plasma from individuals who have had prior COVID-19 infection. And we do use that for other infections as well. So those are the three main ways that when we're talking about decreasing the overall risk of transmission within populations, we're talking about either infection directly with the organism, an infection with the vaccine that produces that immunity without the severity of the disease, or we're talking about antibodies that are provided to a person, and this is usually reserved for individuals who are more severely ill, as we've seen with convalescent plasma for COVID-19, or individuals that are at risk for severe disease, and that we use that for other common diseases that we still see today in the United States.
Okay, great. Thank you.
Yep.
Hey, this is the Argus Leader again. Back in, I think it was April or May, folks were still using the standard assumption that only 10% of cases were being reported, whether or not that was because people just weren't getting tested. Is that still the, give or take, the framework, only 10% of cases? Is that still the assumption? Or with more testing being done, has that number gone down a little bit? Or up, I should say.
So I don't recall any sort of discussion around 10% being reported. We do have it as individuals who have illness should seek medical care, and that does include potentially being tested based on their provider's recommendation. I think what you are seeing, now we have additional laboratory capacity, and we're talking not just about testing individuals who are symptomatic with COVID-19 infection, but looking at testing asymptomatic individuals who are close contacts, the symptomatic individuals who are close contacts, and especially when we're talking in household settings where individuals have a greater duration of exposure and additional types of exposure than we would see in a workplace or in the community setting. And so, we have a recommendation that individuals who are identified as close contacts be tested. And so I think that will help when it comes to identification of infections within the state as well as within the United States.
Next question.
Yes, this is Ben with the Plainsman.
Go ahead, Ben.
Yes, I guess I didn't get on here until late. I was just curious if we could address what the testing was at the Huron testing on Friday.
Sure. So this is Secretary Melissa Risden. You'll recall that the first Friday event had 31 participants. None of those were positive. Last Friday's event had 32 participants, and none of those were positive either. So, I'm sorry, we had one positive.
Yeah,
I apologize.
Yeah, so this is Dr. Clayton. So we did have one positive out of all of those that were tested last Friday, so that does give us one positive out of 63 total that were tested at those events.
Okay, thank you.
Next question.
For the City Journal.
Go ahead, Morgan.
Governor Noem is hosting a huge concert next month presented by Stanford Health. Do you think it's appropriate for one of our largest hospital systems to endorse a big event like this during a pandemic?
I would direct you to that question to Stanford.
Sure. If I could ask a follow-up, what guidance did the Department of Health give to this event, and do you know if masks will be required or if social distancing will be enforced?
So, similar to the guidance that is available on the CDC website, we ask all individuals who are thinking about or planning an event in the state to, encourage them to take a look at the guidance that's out there. As things that we've mentioned previously is when you're looking at larger get-togethers, especially if you're bringing people together from other states or parts of the state, or parts of South Dakota specifically, that might be experiencing a higher level of COVID-19 transmission, that does have impact to the potential for COVID-19 spread at any of those events. And so, part of the recommendations to decrease the likelihood of transmission would include, to the extent possible, physical distancing, wearing of masks, appropriate hand washing frequently, and just making sure that if you are ill, that you are not attending any of those events to hopefully decrease the level and the risk of transmission.
Next question.
JP at KOR News Radio.
Go ahead, JP.
Thank you very much. Haven't asked for a follow-up in quite a while, and so what is the progress with the state, with the testing at congregate living facilities, and also of the first responders that started back in August?
JP, I think we'll want to follow up with you maybe offline here with some actual numbers. I can tell you that for the congregate facilities that we've worked through the mass testing process at those, they are, most of them are now working towards a sentinel testing program so that they will be doing some random tests of asymptomatic staff to try to detect COVID early. And so most of those facilities are moving into that realm, but Derek will follow up with you after the call with some more information on that.
Sounds great. Thank you.
You're welcome.
Next question.
Ray from Kettleland. Ray from Kettleland.
Go ahead, Ray.
Hi. Hey, can you comment on the CDC's last week released something with more information about how the virus is spread through droplets, and then today kind of said it was in error that a draft version got published. Can you make a comment on all that? It seems a little confusing to the public, and quite frankly, not a media.
Yeah, and what I will say is, I mean, this is again kind of the review of the existing literature and the process that the World Health Organization and the Centers for Disease Control and Prevention do on an ongoing basis is to examine the existing literature. As has kind of been mentioned before, when we're talking about COVID-19, the majority of the transmission is occurring, in that droplet area, which would be within 6 feet of a person who is infected with COVID-19, and those are larger respiratory droplets that tend to fall out of the air before they get further than 6 feet away from an individual, which is where we come around with the duration of 15 minutes within that 6-foot space of a person who is infected. And so it's often difficult to understand exactly what sort of environmental impact the HVAC system may have had on the risk of transmission. Talking about individuals who have a higher viral load and the risk of transmission there. But by and large, even when you're thinking about those specific examples that have been identified in the literature that have led to larger transmission events, we still come back to the common denominator